Is there evidence that individuals with autism process information differently than neurotypicals? Let's join Bob through his journey in order to answer this question. Autism is a mental condition which results in difficulty in communication and forming relationship with other people. People with autism are often perceived as socially awkward and as having difficulty learning. This fundamental mental abnormality in autism is thought to also alter the way people in autism process information, but this is still currently in debate. Starting primarily in the 1960s and persisting until the 1990s, scientific models postulated a deficit in the information acquisition, sensory perception, conceptual reasoning, executive function, and high-order abilities in general. The clinical integrity of information acquisition in all proposed models, however, remains largely undocumented and thus unreliable. In order to test the deficit, a study was done. The result of the study provided empirical evidence of previously undocumented impairments in skilled motor, complex language, and complex memory abilities, and thus redefined the profile of neuropsychological functioning reported for autism. Interestingly, the intact abilities like attention, sensory perception, simple memory, and language identified in this study help demonstrate that neuropsychological profile in autism is not that of a general deficit syndrome or of mental retardation, as autistic participants perform as well or better than individually matched typicals. Although local information processing has always been known as the forte of individuals with autism spectrum disorder, this has never been significantly tested in adults. A study was conducted with 42 people with autism, 41 people with Asperger's, and 41 neurotypicals aimed to investigate local information processing in adults with HFA or AS. To assess local information processing, the block design test and the embedded figures test and 2 questionnaires were used. The hypothesis of the experiment was that HFA and AS group were expected to perform in a superior manner. However, the results of this study did not support the hypothesis. The 3 groups did not differ in performance, and the neurotypical group even outperformed the 2 disorder group on the embedded figures test. Visual information processing in people with autism is the same or better than neurotypicals in static spatial information processing tasks, but worse performance on dynamic information analysis. There are 2 theories that attempt to explain this phenomenon, first of which is called the pathway-specific hypothesis, which states that this phenomenon happens because there is a dysfunction in the dorsal system which causes a motion processing deficit. The second theory is called the complexity-specific hypothesis, which states that people with autism have reduced efficiency of neurointegrative mechanisms that work at the perceptual level. After experimentation, it can be concluded that autism can best be described by complexity-specific theory. There is also no impairment in the dorsal system. It is usually unclear if AWA are impaired at recognizing basic facial features. One of the studies conducted in 2006 had AWA in typical individuals perform a forced choice response to all possible combinations of 6 basic expressions: happiness, sadness, disgust, anger, fear, and surprise. The result of the study clearly indicated that there was a difference in recognition of fear, disgust, and happiness. However, AWA were able to discriminate between different emotional images, indicating that low-level perceptual difficulties do not hinder emotional recognition. Besides the ability to recognize faces, neurotypicals have been able to understand the mental states of others through others' voices. The brain area responsible for this is located in the upper bank of the superior temporal sulcus bilaterally. Gervais and her colleagues found that neurotypicals showed significantly greater brain activity while listening to vocal sounds compared to non-vocal, while AWAs showed no difference at all. However, there is 1 out of 5 AWA in the study that exhibited normal activation of his STS. This goes to show that AWA individuals can fall in any location of the ASD spectrum. Not all of them are going to have abnormal cortical voice processing. It is clear that people with ASD have different type of cognition than neurotypical people. Impairments in motor, complex language, complex memory, and reasoning domains are matched by superior performance in attention, sensory perception, simple memory, simple language, and visuo-spatial domain. People with ASD tend to be more detail-oriented and tend to struggle in social situations. Some of these impairments can also be overcome and are often done through therapy and years of being taught how to interpret emotion.
Created using Powtoon.